Senator Ifeanyi Ubah, Anambra South.
Thank you, Mr. President. A bill and lead debate Federal Medical Centre Uli, Anambra State.
Distinguished Senator Smart and then, please come.
Distinguished Mr. President, distinguished colleagues, permit me to lead the debate on the bill for an act to establish the Federal Medical Centre Uli, Anambra State, and make provision for its due management and administration. Mr. President, this bill was read for the first time in this Hollow Chamber on Wednesday, 22nd July 2020. This bill was put together in response to the cries of my constituents, women and children who are in dire need of well-equipped healthcare centers. This move for the establishment of the Federal Medical Center is therefore informed by the need to bridge the existing gap between primary, secondary healthcare and tertiary healthcare delivery in Anambra State and Nigeria as a whole. The gap between primary, secondary and specialist healthcare in Nigeria is widening, Mr. President. There is no seamless transition from one to another due to a number of factors. The factors include accessibility to medical facility, affordability of Medicare, as well as inadequate medical personnel at primary and secondary healthcare levels. Mr. President, distinguished colleagues, communicable diseases have continued to ravage many Nigerian communities due to the distance between the community and tertiary healthcare institutions. Patients cannot access specialist hospitals where their ailment can be properly diagnosed and adequate treatment given. This unfortunate situation has also compounded the challenge of maternal and infant mortality. Densely populated urban and rural communities are worse hit. Their poor economic situation makes resort to patronizing private hospitals near impossible. Mr. President, distinguished colleagues, the Nigerian National Health Policy is very clear on the role of different tiers of government in healthcare delivery. Primary healthcare is to be provided by local governments, while secondary healthcare by state governments and tertiary healthcare by the federal government. In operationalizing this policy, federal medical centers fill vacuums created by either the non-existence or inadequacy of a federal university teaching hospital in a state. The Federal Medical Center, like its counterpart around the world, is envisioning to multidisciplinary space for treatment, research, harnessing science, and developing innovative means of tackling the numerous health challenges in the country. Additionally, Mr. President, when established, the center will perform following functions: to equip, maintain, and operate the center so as to provide facilities for diagnosis, preventive, curative, and rehabilitative services in medical treatment; to support and provide enabling environment for medical training of personnel as the board may consider necessary; to run an effective and cost-effective medical services to Nigerians; and to review and update medical findings and research from time to time.
You say the Ministry of Science and Technology.
Federal Medical Centre Uli, Anambra State will provide services in specialized areas like neurosurgery, cardiology, urology, orthopedics, pediatrics, internal medicine, radiotherapy, ear, nose and throat treatment,
Somebody's mic.
gynecology, psychiatry, nuclear medicine, and other fields of medicine that may be required by Nigerians. I therefore urge Mr. President and my fellow distinguished colleagues to take a giant step in the right direction by supporting this bill for the second reading. In line with Order 76.3 of the Standing Senate Order 2022 as amended, accompanied by financial implication of the establishment of Federal Medical Centre Uli, Anambra State is hereby attached. Thank you,
Hello?
Mr. President, for the opportunity.
Whose phone is? Abga.
Thank you, Mr. President.
Thank you very much. The single Senator Smart Ademi.
Mr. President, I rise on behalf of the people to commend my very good friend, distinguished Senator Ifeanyi Ubah, for proposing this bill. The bill to establish a Federal Medical Centre Uli.
The single Senator Smart Ademi.
Yes, sir.
You know that that's not the conventional way of introducing yourself to your colleagues. You say you stand on behalf of the people.
Mr. President, we have been in this struggle.
Which people?
We have been in this struggle for a long time, Mr. President.
Not struggle. You have not been any struggle. Which people?
This struggle is our life. This struggle is our life. Mr.
Please, if you have territorial ambition, you should limit it to after elections. You represent Kogi West.
Mr. President,
so you represent Kogi West people. You can go ahead now.
Thank you, Mr. President. This bill, Mr. President, deserves the support of every one of us here today. More importantly, this is a bill that is aimed at expanding the facilities and training of manpower in the medical science. I think more than any time in our history, Mr. President, we must be looking at how we can develop the medical science in Nigeria and making it affordable for every one of us. More importantly, as mentioned in this bill, it talked about the medical center that will provide services in specialized areas such as urology, cardiology, and quite a number of the ailments that over the years made Nigerians to developed nations seeking for attention. And the more we have medical facilities in our nation, I think the better for us. And I think, Mr. President, that we can go ahead to get this bill passed because part of the aspiration and desire of Nigerians to have enough medical facilities spread across this country. Medical institutions or centers in any part of the country must be of concern and deserve the support of all of us because no one knows when there will be need for medical attention. So I want to commend distinguished Senator Ifeanyi Ubah for this bill, and I want to submit, Mr. President, that I think we should also submit this bill, support this bill, because it's going to reduce medical tourism. In essence, it might reduce the number of Nigerians, especially the privileged Nigerians who often go out of this country for improved medical facilities, medical attention. I think if we support this bill, it's going to be in addition to existing facilities that we have. I so support, Mr. President.
Distinguished Senator Nora Ladida, Plateau South.
Thank you, Mr. President. I'm Nora Ladida, representing Plateau South Senatorial District. My distinguished colleagues, I want to add my voice to my two colleagues who have presented this debate on the necessity of this Federal Medical Centre Uli. I will want to say this to distinguished Senator Ubah Ifeanyi, that it's not only women and children that are crying. I'm sure the men too are crying silently. And I believe that this particular bill would not just add values to the needs of this particular senatorial district, it will also uplift the health condition globally, because it is nothing to debate on. Health is paramount. As we always say, health is wealth. So I believe that this is a very timely and urgent need that we should promote in order to help our constituents all over. And lastly, I want to congratulate him for bringing up this bill, because any bill that touches the lives of human beings, I think we should not play with it. And I believe that this is a way forward in promoting our health issues in the country. So I support that this bill be read and be passed through the necessary process. Thank you, Mr. President.
You suggested I should put the question, is that right? So she said there's no need to continue any debate. And I agree with you. This is a very important bill. Those in favor that this bill will have read the second time say aye. Those against say nay, the ayes have it. Clerk of the Senate.
Mr. President, distinguished senators, a bill for an act to provide the legal framework to establish the Federal Medical Centre Uli, Anambra State, and for related matters 2023, second reading.
A bill for an act to provide the legal framework to establish the Federal Medical Centre Uli, Anambra State, and for related matters 2023, second reading taken. And the bill is referred to the Committee on Health to report back within 4 weeks. Leader